Gentle disclaimer to all of our listeners. All medical information mentioned in this podcast is purely informational. It is not individualized medical advice. Please follow up with your physician or medical practitioner for individualized care specific to your needs. Thank you. This episode is a special episode because it is a live recording of my presentation at EndoFound's 15th Annual Patient Symposium, Endometriosis 2024. And at this event, it was the Together for Tomorrow event. Endometriosis Foundation of America, also known as EndoFound, asked me to present on pelvic floor physical therapy, specific for people with endometriosis. You are about to listen in to the presentation that I did live on Sunday, March 3rd, 2024. It was a great weekend of many different providers and specialists involved in the endometriosis world, involved in treatment, also patients. I hope you enjoy this informative chat. Hi, everyone. My name is Melanie Carminati. I'm a doctor of physical therapy and pelvic floor physical therapist and owner of Inspira Physical Therapy in Brooklyn. I'm really happy to be here and to speak about pelvic floor PT, and we'll be chatting about some osteopathic techniques towards the end of this presentation. And just want to take a moment to thank Dr. Sechkin for this opportunity, and thank you, Carolyn Mayer, for organizing all of this and keeping me in the loop. As I mentioned, I'm a doctor of physical therapy. At Inspira, we specialize in pelvic floor PT and complex orthopedics. We do see many patients with chronic pain from different causes, as well as people with EDS and HSD at our office. I myself was adjunct professor at Fordham teaching anatomy and kinesiology, so I love to present and teach. And I've been a teaching assistant at Herman & Wallace before for the pelvic floor PT training. So what does the research say in terms of your pelvic floor and people who have endometriosis? So this study here, what they did is they followed 92 women who have endometriosis, and what they found is that 93.3% of the women have pain, and that 75% of them have increased tone in their levator ani muscles. So that is the deep pelvic floor musculature. Additionally, more than half of those women have impaired pelvic floor ability to relax. So we'll talk about hypertonic pelvic floor, really common in people who have endometriosis and a common source of pain. Additionally, in this systematic review, they looked at all different research studies and found that pelvic floor physical therapy helps to reduce pain in people who have endometriosis. Additionally, it helps to improve their quality of life. So your pelvic floor and endometriosis, most of us have heard of the word pelvic floor. If you're not sure, I will be explaining that in a little bit, but in just a quick snippet now, the pelvic floor musculature is a 3-layered muscle group. It's kind of like 3 hammocks sitting one on top of the other, and the muscles run from your pubic bone all the way back underneath where the underwear runs to your tailbone. And now what we find in pelvic floor physical therapy, it really varies based on the person. Of course, everyone's individual medical history is slightly different, but what we find from an objective standpoint for the pelvic floor is that the pelvic floor muscles are commonly hypertonic or held in a state of spasm. Then additionally, because of this, when the pelvic floor muscles are hypertonic, they are weak. So the pelvic floor muscles can be tight and weak. Besides the pelvic floor, there are diaphragm breathing dysfunctions that we find, different myofascial restrictions through the abdomen, muscle tension in the iliacus and psoas, some other deep muscles. And from a subjective standpoint, I'm sure that most of us here in the audience can relate to some of the points that I have under there for the subjective history. But we find that people with endometriosis report painful intercourse, also known as dyspareunia, pain with urination, urinary frequency, bloating, painful periods, back pain, and hip pain as well. So what is your pelvic floor? I already mentioned before that the pelvic floor muscles are a multi-layered muscle group, but the pelvic floor is actually part of your deep functional core. So the pelvic floor muscles work with other muscles. There is 4 main muscle groups that we use when we describe the deep functional core. And the muscle that the pelvic floor responds and moves with in synchrony is the diaphragm. So the diaphragm, underneath the diaphragm, we have our organs that are kind of suctioned underneath. And every time you inhale, the diaphragm descends, pelvic floor moves in response, and then as you exhale, it comes back up. However, if there are adhesions or muscular tension, that normal rhythm in the diaphragm and the pelvic floor is dysfunctional. So there are different functions of the pelvic floor: support, sphincteric, sensual, stability, respiration, and mobility that we just touched on. This image here I love because you can really clearly see in that top right image, this is from Netter's Anatomy Atlas, my favorite. You can see the superficial or first layer pelvic floor muscles, and then you can also see in the bottom half the deepest layer, levator ani muscles. So we all know about the pelvic floor, but there's actually a pelvic wall. We have pelvic walls on each side made up of the obturator internus and piriformis muscles. I mentioned before that sometimes people with endometriosis have hip and back pain. And so when we are evaluating and assessing patients with endometriosis, we are considering the lumbar spine and the hips as well. And these muscles, the pelvic wall muscles, they help with pelvic stability, but also are involved in rotation of your hip. What you can expect from a pelvic floor physical therapy assessment. The first thing we're going to do is talk a lot. There's a lot to cover. We're going to talk about your history in terms of sexual function, urinary function, bowel, if there's any sexual traumas that we need to bring up. We will also talk about exercise, sleep, fatigue, energy levels, all of that, so we have a full understanding. If you have had any surgeries, we will obviously talk about that as well. If you are planning on surgery, we will talk about that. And then from the physical assessment, we will look at you holistically. So we are one person, one body, so we will look at you from head to toe, see how your posture is, assess your walking pattern, check your abdomen, check through the hips, check the lumbar spine. And then for the pelvic floor specific assessment, it's very medically based. You would wear a gown, take everything off below the waist, and everything is with your consent. So you're always in control of whatever happens. But we would start first with just an observation, seeing if there's any changes in the tissue externally. And then again, with permission, palpating externally for different points so we can see if there's specific points of muscle tension that we're noticing externally. And then with a change of gloves and some lubricant, and again, permission, we would be checking internally, layer by layer, through those pelvic floor muscles to see what muscles are tight, spasmed, and the source of the pain. When we are internally, we can get the true sense of your strength and function of the pelvic floor as well. So pelvic floor PT treatment, I listed some of the manual therapy that we do. It can incorporate some of the osteopathic techniques like visceral manipulation. Visceral manipulation that we use at Inspira in Brooklyn is the method codified by Jean-Pierre Barral. It's extremely helpful for releasing myofascial restrictions through the abdomen and promoting that normal motility in your visceral organs. Additionally, we'll do any external and internal pelvic floor manual therapy that's needed. Depending on the person, we might prescribe dilators or wands. For neuromuscular reeducation, if we are speaking specifically to hypertonic pelvic floor, we will first work on down training of the muscles, getting the muscles to relax fully. And then after that, we will, at a particular point, it's very subjective and specific to each person, but then retrain for uptraining. So I mentioned in the beginning some osteopathic techniques. And I know throughout this weekend, everyone's been speaking about how being in chronic pain changes your central nervous system. When we are treating pain, we have to remember this, because if you are having persistent pain, I like to use the analogy that it's like being in a room, or imagine this room, and the fire alarm is going off the whole time. Sometimes you might have breaks, but understandably, that would change your mindset and how you are operating in your life. So being able to address the central nervous system first is crucial. So we use different osteopathic techniques like craniosacral therapy, vagus nerve manual therapy, visceral manipulation to downregulate the nervous system before we do any of the other manual therapy. At our office, we use wind-back to car therapy. It's a form of radio frequency. There are other devices that do this. I know in Europe there are many others. Wind-back is the one that I'm most familiar with in the United States. It is FDA approved, and it's being used at Johns Hopkins pelvic floor program as well. But when we use the radio frequency, the therapist will wear a bracelet on their forearm, and the radio frequency current actually is transmitted through our hand. So when we do the internal or external pelvic floor manual therapy, the current is transmitted into the pelvic floor. For the patient, it just feels like a warming sensation, so it's actually kind of nice. And if we are treating hypertonic pelvic floor, it helps the muscles to relax and lengthen, and we see longer term benefits of the manual therapy when we use it. We did a case study on it. It's on our website if you want to read the whole thing. I'm just going to mention that it is extremely helpful for dyspareunia as well. In terms of exercise considerations, just putting this up there just to mention diaphragm breathing, relaxation, meditation, pelvic floor stretching that we mentioned before, core re-education. And then because I'm fully certified in Pilates and we use Pilates in our office, spinal mobility is tremendous, especially after we do visceral manipulation or any kind of manual work. And obviously, there are many providers who have presented over this weekend, so you all are aware of this, but I encourage you to find your team of providers. It takes a team. This is a multi-system disease, and it is really important to have a team that's collaborative as well. So I know for myself, I'm always checking in with my patients' physicians or healthcare providers, whoever they are, even movement practitioners that they work with, just so we're all on the same page. And it helps that much more with progressing in rehab. Just want to finish up with just validating everyone in the room, just so you know that your experience is real, and encourage you to find a provider who listens to you. It is very important to feel that you have that trust with the provider, and it's just better for your well-being and your progress. So I have a team of 2 other pelvic floor PTs. There's 3 of us total, 3 Pilates teachers, massage therapists as well. And we work with many, many people who have endometriosis, and we're happy to help. We're having our Endometriosis Brooklyn event in March 21st. Dr. Chu is actually going to be the opening speaker, so if anyone's in Brooklyn or local and wants to come, please come. Here's some contact information. We're on Instagram, we're on Facebook, we're on TikTok too. Thank you. Thank you all so much. So as you may have just listened, I mentioned our upcoming Endometriosis Symposium Brooklyn 2024, which is happening here in Park Slope, Brooklyn on Thursday, March 21st from 6 to 9 p.m. We are very excited. We have an amazing lineup of featured presenters and special guests, starting with Dr. Amanda Chu of Sechkin Center, then Dr. Deborah Barbieri, pain psychologist, followed by Dr. Michael Lewis of New York Presbyterian Methodist Hospital. He is an endometriosis surgeon. After that, we will have Dr. Murray Orbach. He is a gastroenterologist here in New York City. After that, we will have a brief clip of a pre-recorded interview with Dr. Juan Salgado from Puerto Rico. He is an endometriosis surgeon as well. And then we will have a pain management panel discussion. This will feature Dr. Seiferman, Dr. Kane of Manhattan Pain Medicine, the Inspira Physical Therapy team, myself and Dr. Milo Lahanda, as well as Peggy Robinson of Cornerstone Healing. The night will close off with a keynote speech from Deborah Kopikin, New York Times bestselling author of Lady Parts. Throughout the evening, we will be blessed with the art on display from Kyung-Jun Miranda and Edgardo Miranda Rodriguez. It's going to be an amazing night. There will be food and drink, and we are so excited because this is our 2nd annual endometriosis event. Last year was our first year here in Brooklyn, and it was such a moving experience to be in a room of so many people wanting to learn more about endometriosis, better themselves and better the loved ones and people in the community around them. So we hope you enjoy, and please join us. Sign up on Eventbrite. We will have the Eventbrite link in our bio description. Feel free to call or text us at 929-295-6566, and or you can email us at hello@inspirapt.com. We look forward to having you there, and thanks for tuning in.